colleagues, it's with immense pleasure that the organizing committee cordially invites you to attend the second Moroccan Society for Endometriosis and Reproductive Medicine, to be held from 24 to 27 November 2022 at Fez in Morocco. MSERM 2022 has a cutting-edge scientific program designed to foster innovation and collaboration to fill the gap between science and practice in assisted reproduction. The scientific program includes plenary sessions which will give an update on the current knowledge in basic science, identify important gaps, cover the state of the IRT in clinical practice, and address the future trends associated with endometriosis and other uterine disorders. We will explore how these disorders affect women's health and their quality of life, and how we can correct myths and remove stigma around menstruation and pain and the underlying conditions. We hope to build on the already outstanding tradition of the MSERM and develop further opportunities to shrink the gap between science and clinical practice. The conference will be held online from Fez in Kingdom of Morocco. On behalf of the Moroccan Society for Endometriosis and Reproductive Medicine, we invite you warmly to this important meeting to share your research, debate, and discuss, exchange ideas, network, and above all, enjoy. Thank you.
Hello, it's Dr. Bahar Yüksel Özgür from Turkey. I'm an associate professor in obstetrics and gynecology and especially specialized in endometriosis disease. Also co-founder of Endometriosis Research and Support Society in Turkey. In the Congress, I'm going to be talking about the only diagnostic method that we have in our hands today, which is the symptoms. I'm going to be talking about what to ask to patients and what to expect from our results. So, can't wait to meet you up in the Congress in November. See you.
Good morning, I'm Ahmed Jibril. I'm a professor of obstetrics and gynecology in Mansoura University. I'm very pleased to be with you in the Moroccan Society for Endometriosis and Reproductive Medicine. I will be speaking about the causes of infertility in women with endometriosis. Very happy to see you at this meeting. Thank you.
I'm Dr. Ilhan Rahman. I'm a medical geneticist and professor of genetics at the Faculty of Medicine and Pharmacy in Florida. I'd like to wish you a nice welcome to the second edition of the Moroccan Society of Endometriosis and Reproductive Medicine Congress to be held this November at the Global City of Fez. This meeting at the session on developments in reproductive genetics, where I will be lecture about the genetics of male infertility in the era of discrimination. See you there.
Thin endometrium means when the endometrial thickness is less to 7-8 mm. The incidence of thin endometrium has been reported up to 38 to 66% in the ovarian stimulation cycles. So how to manage this thin endometrium? What are the new advances? Yes, we all know we are giving the different drugs for that management. Now what's have come new? The GCSF, the PRP therapy, how the results are coming. So hello everyone, I am here Dr. Ritu Santpani this side, founder and CEO of 360 Degree Healthcare Studio. I am from Pune, India. So friends, I am going to discuss about this, the management of thin endometrium on the second Worldwide Conference of MSERM on 17th to 20th November at Morocco. So friends, please do join with us for the interactive discussions. I will wait for all of you. See you all there. Till then, bye-bye.
Also, this chair of scientific committee Moroccan Society our second edition of the Congress will be in Fez between 17 and 20 of November. And my talk will be on the second day, on the Friday morning, in the session 30 years of ICSI already. My lecture will be on extreme situation, very difficult sperm and very bad sperm. Could we do or not do this ICSI with consequences of this?
Hello, I'm Joyce Harper and I'm Professor at the Institute for Women's Health at University College London, and I hope you can come and join us at the second Moroccan Society of Endometriosis and Reproductive Medicine Conference this November in Fez in Morocco. And I'm going to be talking about the International Fertility Education Initiative and why we need to teach fertility education. If you want to find out about the conference, just put MSERM into Google and you should see the programme for the 2022 conference. Hopefully see you there. Bye.
Hello everyone, best regards to all of you. We would like to invite you to the second annual MSERM Worldwide Hybrid Congress 2022 on 17 to 20 November. For your interest, my presentation will be within the session of medical embryology that will be entitled Data Science of Sperm Preparation and Selection Technique for Assisted Reproductive Technologies, and on Sunday 20 November 2022 in Hall A. Waiting your attendance. Welcome to the Congress. Hope to meet you, inshallah.
Hello everybody, I'm Dr. Wassim Snahaji from Morocco. I'm a gynecologist and obstetrician specialized in fertility and endoscopic surgery and very concerned by endometriosis. I'm very pleased to be your host in Fez as Vice President of Moroccan Society for Endometriosis and Reproductive Medicine, and will be honored to present during the Congress in the session of infertility management my lecture about low AMH and infertility, how to manage it in the Moroccan context. So don't miss our international journey and be with us in Fez from 17 to 20 November 2022. See you.
Hello, I'm Dr. Abdul Hafid Abu Dhair. I'm Professor of Obstetrics and Gynecology working at Yashfin Clinic in Tripoli, Libya. I would like to thank the Moroccan Society for Endometriosis and Reproductive Medicine for their kind invitation to attend their conference, which is going to be held in Morocco, Fez, November 17 to the 20. I'm going to speak about laparoscopic updates in endometriosis. I'm looking to see all of you there to enjoy the scientific event and the social as well. Thank you.
Researcher will be looking at a lot of suggestions and maybe a lot of conclusions, and finally, like everything else in the last 35 years, will gradually come to some consensus of what is best practice.
I would like to share with you my vision of the future of IVF. It's really very difficult to guess the future. But I know that technology will be super important in IVF, in the IVF lab. There's no doubt that IVF has been really a manual procedure up till now. So we have manually moved the cells, we have manually manipulated the cell, making the biopsy, the ICSI, everything rely on the operator. Assessing the morphology rely today on the operator. So this means that there's a huge difference between one lab to the other. And this is not really what we want in healthcare. What we want in healthcare is that everywhere, in every single lab, we can ensure for our patient a minimum standard. And to reach this goal in every single country, everywhere in the world, we need to have more technology. More technology means more standardization, more reproducibility. Imagine a software that would assess artificial intelligence and big data. Software can really learn from the data that we provide to the software.
In babies, both IVF and even sexual intercourse may be made redundant. Reproduction may be done just in the laboratory, using egg and sperm from somatic sources, using stem cell-derived human gametes. Mitochondrial replacement will be used more and more to prevent some horrible lethal diseases, and may even be used to make older patients younger, before rushing couples straight from the street into IVF. Bye for now.
Zef Shoham, as chair of IVF Worldwide, asked me to share with you my views on what I would consider the most relevant developments in the next decade. And I give it some thought, and as far as I'm concerned, there are 4 issues which I would like to stress. Number 1, I think that there will be much focus on IVF, make it more simple and more robust, in line with that, reduce cost and increase access to care. That's the first and I think most important development. Development number 2 is many technical advances and automated systems in the embryology laboratory, and from the clinical side, the introduction of e-health and the use of artificial intelligence and big data. Not per se. What I mean by this is the use of ART in single individuals who wish to have children, or same-sex couples, both male and female.
The future of IVF is extremely bright. Advances in technology will not only help improve success rates, but also will make IVF more accessible so that everyone around the world has the opportunity to have a family.
IVF started more than 40 years ago, and time is running very fast, and the future is approaching even faster. Many changes occurred during this last decade, from infertility treatment to conservative management of many gynecological diseases and fertility preservation. No doubt that more and more we will pay attention to conduct a more conservative and gentle approach in many gynecological diseases. And we should pay attention in the new algorithm to take care of the patient desire.
Dear colleagues, dear friends, I am happy you are here with us today. What I think is exciting in our specialty in 2020 is that we are able to propose to almost all our patients a solution, a treatment, hope, as the progress that was made these last decades in infertility, infertility preservation and IVF was huge. So let's continue that way.
Well, the future of IVF is difficult to tell in advance what's going to happen, but there is a general trend toward stabilizing the results so that all clinics really have the same thing. And what we're going to be talking today about the KPIs and key performance indicators is heading in that direction. And also, I think the future of IVF will consist in trying to transfer embryos that have good chances of implanting, either by PGTA, as we do now, or maybe one day we discover a way to do this non-invasively. But the bottom line is to transfer embryos that have chances to implant, and not those who are bound to fail anyway.
So I actually believe that in the future, with all the improvement in technology, genetics, and the issue of the big data, we'll all need to gather information on our patient characteristic, put it in the computer, and the computer will tell us which protocol we should choose, which mode of treatment, trigger, the medication, and even also if the patient may benefit from all of these add-ons that we are offering the patient now, and we don't know if they're actually improving the outcome or not.
I believe there will be a huge progress in the three factors that govern embryo implantation, and these are embryo quality, endometrial receptivity, and the transfer efficiency. A lot of these will be automated based off artificial intelligence, so that the sustained embryo implantation rates would reach sky high.
My vision for the next 5 to 10 years in reproductive medicine is heavily leaning on the development of pre-implantation genetic diagnostics. I think this is a booming area where the technology of IVF and ICSI is now used to prevent many diseases that can keep people and healthcare workers busy for many centuries. So the prevention of diseases like Huntington, cystic fibrosis, Recklinghausen, well, there's a long list of potentials. I think this is really a big future for assisted reproduction. And my second line is that I think within 5 years we probably do freeze all only and refrain from doing fresh transfers because of the problems that we have with all the luteal support issues. So I think the freeze all is part of this future development.
If I had to summarize the future of ART in 2 sentences, I think number one would be the future of automation in the lab. I think a lot of manual things that are being done today by technicians and embryologists will be done by machines in a much more precise manner. And the second concept would be probably editing the germline. The possibility to relieve the burden of genetic conditions, and even the fact and the huge revolution of the stem cell development of gametes from somatic cells, I think will change completely the way we practice. And we'll see if in the future we're right or not.
Professor Zef Shoham has asked me to say a few words about what I think are the future directions of IVF in the next 10 to 30 years. I have 3 or 4 points to make. The first is that there's today a rapidly aging population, and with delayed childbearing, declining number of children, and an aging workforce, this leads to an increasing number of retirees being supported by a smaller workforce, which causes tremendous strain worldwide in their social systems. Universal egg freezing may help to elevate this idea. Universal egg freezing, in which every young woman in her early 20s would have a single ultrasound scan performed around day 8 to 10 of the cycle, so that when the biggest follicle is between 12 to 14 millimeters in diameter, a single channel 19 to 21 gauge quasi-lumen needle is used to both aspirate and flush if needed, could be used to aspirate a large number of mature and a huge number of immature eggs in a single cycle. We have in fact already collected more than 100 eggs in each cycle using this technique. These eggs could then be frozen using automated vitrification machines, which eliminates human variability. The availability of literally thousands of eggs for each person will allow genetics tests to be done to screen out aneuploid and other genetic abnormal embryos and eggs.
Is at 2 different levels.
There's first of all the scientific level, where I'm pretty certain that over the next 5 to 10 years, we will learn two very important things that will dramatically change routine IVF practice. One is to culture in vitro primordial follicles to maturity. If we can achieve that, we can really do fertility preservation, because it will be possible to do a tiny biopsy of cortical tissue from the ovary and get hundreds of eggs that can be frozen away. You will not have to torture patients through multiple IVF cycles for much smaller egg numbers. But the ultimate step that will really change IVF, both routine IVF, but also in many social aspects, is our ability to create new eggs and new sperm from stem cells. In the mouse, that was achieved already a number of years ago, so I'm convinced it is doable. It raises a million questions.
Oocytes for women who no longer have young oocytes, and will be making very young oocytes using iPS cells derived from a simple skin biopsy. So even for a 38-year-old woman, it might be better to do a skin biopsy than an egg retrieval. So it's distant future, but the science is there. It's going to happen. It works certainly in animal models, and we are starting it now in humans on an experimental basis. But in addition to that, I think that the trend towards having babies later and later is going to increase, and fertility preservation will be high pressure, but women still won't do that. It will not grow like it ought to grow, because psychologically you just don't think at age 25 you have to worry about it, and you usually worry about it by the time you're 38 or 40. So it won't grow like it should. But I think egg donation will become a booming part of IVF for that reason.
Have now normal human follicles available. And I do think we are now slowly moving down the ladder, understanding how smaller follicles are being developed. Each one of these follicles contain an immature oocyte. These may be follicles which just have a few millimeters in diameter. I do think that we will see a huge development in our ability to in vitro mature these oocytes. And we will be able to just treat these oocytes in 25 microliters of culture medium. So it will not be necessary to the same extent to stimulate women to undergo ovarian stimulation and have mature follicles. We will slowly start to understand how we do this with humans, as we can do with most other domestic animal species. I do think that in 10 years' time, we may approach an exogenous-free gonadotrophin infertility treatment, which would be absolutely fantastic in my view.
My vision for the future of IVF treatment is that ovarian stimulation will be more personalized thanks to our ability to analyze and extract insights for large data sets. I think that the industry will successfully produce molecules.
Hello, I'm Professor Iman El-Gindi, Chair of Scientific Committee of MSERM. Current year, I'm going to present two lectures. The first one will be about the optimal preparation for the endometrium for transfer of frozen embryos. Well, I will stress on our recent published study current year on RBM Online about a novel protocol for preparing the endometrium to receive the good quality prosthesis. This will be my first presentation. The second one will be about what is the success in ART from different perspectives. Welcome to the second Congress of MSERM.